Joining me now in the studio is Nsiabase Kanem, public health physician and CEO, Trinity Healthcare Foundation. It's nice to have you join me right now.
Good morning.
Great.
Good to see you.
Good to have you in the studio.
Thank you very much.
All right, now, when it comes to the issue of hepatitis is quite popular when it comes to the name, but not a lot of people know how it affects people, how it is gotten, how it is contracted or transmitted, and all of that. Can you break that down for us?
Okay, hepatitis on its own is an inflammation of the human liver.
Okay.
It's an injury to the human liver, which sometimes...
So the liver is the #1 victim?
That's the target organ.
Okay.
That's where it goes to. So once it gets into the body, it targets the liver and continues to destroy the liver, damage it progressively until cirrhosis occurs in the liver. When cirrhosis occurs, that is a way towards liver cancer. Most people who die of hepatitis die of liver cancer. So that's exactly what happened. But people can live with it for many years. In fact, the reason why you see most people, like it said, about 290 million people across the world don't even know they have the virus because it doesn't manifest symptoms. It's such an asymptomatic disease. Now, the reason is because the liver is one excellent organ that has what we call an organ reserve capacity. Okay. Now, that capacity helps it to pretend as if it's still okay when it is almost totally damaged. So you see people living with acute hepatitis, you see them living without any symptom, they will tell you they're fine. They don't have any problem, right? Not knowing that there's something inside their system attacking their liver, and then it just happens one day, and then it becomes
all right, there is hepatitis A, B, C, D, E. I don't need this F, but there's at least there's A, B, C, D. Can you, which is which and all of that?
Okay.
What are the categories of all of those?
Exactly. So we have 5 types of the virus.
Okay.
A, B, C, D, and E.
Okay.
Now, hepatitis A is a very mild kind of hepatitis. It's the sort of hepatitis that you get when you probably eat food or drink water that has been contaminated with the virus.
Okay.
Now, the same thing applies to hepatitis E. So A and E are basically contracted through contaminated foods and water. Now, hepatitis B is that which is contracted through contact with contaminated blood, contaminated body fluids, like the semen, vaginal fluid, plasma, the blood itself, anything that makes one to be exposed to a contaminated blood can increase the person's risk of contracting hepatitis B. Now, of course, from mother to child transmission is very high right now. Now, hepatitis C shares something similar in terms of the mode of transmission. Okay. So it's the same thing from contaminated blood, contaminated fluid, body fluid. So that's exactly how people contact hepatitis C. Okay. Hepatitis D is a super infection of hepatitis B. So you find it only in people that have had hepatitis B for a pretty long time. Okay. So
which is most dangerous? Is it C or B?
Hepatitis B and C.
B and C
are very dangerous.
Are they curable?
Well, hepatitis C is curable now, but hepatitis B remains incurable. And unfortunately, we have more of that in the world. I mean, globally, we have about 270 or rather 250 million people across the world living with hepatitis B alone. All right. And then, of course, 71 million living with hepatitis C. So you look at the numbers. B is more endemic across the world. Even in Nigeria, we have about 20 million people in Nigeria living with hepatitis B, and just about 4.2 million living with hepatitis C.
But there is a vaccine for this.
There's a vaccine for hepatitis
That one vaccine, does it prevent all the...
No.
Oh, okay.
It's for... right now, we have a vaccine for hepatitis A and hepatitis B. Okay. Unfortunately, hepatitis C does not have a vaccine up until now. So basically, in terms of prevention, we tell people that, look, to prevent hepatitis C, you have to observe the precautionary measures.
Okay.
All right.
All right. We have to leave it here now, but this discussion is going to continue because today is World Hepatitis Day, and we will beam Searchlight more to understand what even the government is doing and what we all have to do to prevent and even bring the numbers down.
Let's begin with COVID-19's impact on accessing treatment for hepatitis. There are concerns because not just for hepatitis, a lot of persons have said not to be able to access vaccines and the likes. Talk to us from this window how COVID-19 pandemic has affected hepatitis treatment.
Okay, well, you know, for hepatitis, it's a chronic disease.
Yeah.
And it needs regular monitoring. And of course, for those who are already infected, they need to always see their physician, their consultant, so they can review their treatment. This has been seriously hindered by the COVID-19 pandemic. There's a lot of fear around visiting hospitals because of hospital-acquired infections, nosocomial infections. And in this case, COVID-19 has made a lot of hepatitis patients, to rather stay back. And some of them are actually missing out on their appointments, and they are not following their therapy as they're supposed to. I know that I lost about a couple of patients because of this COVID-19 pandemic. Again, for those who are not already down with hepatitis, who are not infected, who ought to get vaccinated. You see, it becomes very difficult because some of them who are supposed to be vaccinated don't go because of the COVID-19. Again, the entire health system is overwhelmed, such that health officers that are supposed to administer vaccines are busy trying to fight COVID-19. So this in its entirety has affected a lot of people as far as COVID-19 is concerned.
So does this in any way, because the World Health Organization is looking at a hepatitis-free world by 2030.
Yeah.
For us as Nigeria, how has that impacted with all you have said now? Are we on track in the first place? And with COVID-19, how has this slowed us down?
Well, I would say that, frankly speaking, we are not much on track, unfortunately, because right now we have about 24 million people in Nigeria living with the virus.
Wow.
Yes, and if you look at our strategies towards achieving elimination, you can see that it's not actually possible for us to get it by 2030, except we have huge government presence. That's why we are calling on the government that, look, there is need for investment. We need to stop mother-to-child transmission through making sure that there is a universal coverage of hepatitis B vaccine at birth. We need to also ensure that adult vaccines of hepatitis B vaccines are also available for adults who are at risk, especially those that are related or living with people that are infected with the virus. COVID-19 has further slowed this down by even making sure that people who are supposed to access these services cannot. For example, people that are supposed to go pick up their antiviral medications, those who are on directly acting antivirals, are not going. And because of that, the viral load is growing. And once the viral load grows, you become a risk to everybody around you. So COVID-19 has, to an extent, slowed down our achievement of this goal. And we hope that the pandemic would soon be over so that people can resume their normal appointments and pick up their medication, because for hepatitis, early treatment and vaccination is the key to elimination.
But how do people get to know that they have hepatitis if we say that it has no symptom?
Well, the most important way which we advise is testing, voluntary testing. If you are waiting for the symptoms to manifest, I tell you, it might never manifest. Or it may manifest when the disease has reached its fatal stage. So most people only discover probably when they are going for a blood donation, probably when they are going for job interview or medical screening at their job, at their offices. But we are saying that every Nigerian should go to a good laboratory or a hospital and carry out the test. It's a rapid test. In less than 2-3 minutes, you have your result. Oh, wow. And once you have that, it shows that you are negative. If you are negative, then you go in for the vaccination. The guideline is that as soon as you realize that you are negative to hepatitis B, get vaccinated immediately. Why? Because if you step out there, you might contact the virus and become positive. I've had patients that were tested in December. When they shifted their jobs, probably when they left to another job, they did a medical screen and they were positive in January. So that means that they got infected within the space of 1 month.
Quickly now, so how do we commemorate this day, seeing that there is a pandemic in place and we're trying to, flatten the curve and not have as much gatherings as possible?
Yes, it's important that as much as possible we encourage ourselves to get, tested. These days testing has been simplified. Like I said, it is rapid. You just walk into a laboratory and the test is done within 3 minutes. You don't need to spend time. You don't need to be, scared that probably you will contact COVID-19. So why stay at home? Go there and do it. And of course, there is even a platform right now where you can even order your screening from the comfort of your home and your offices. So people will come, get the sample from you, even run the test and tell you your result, and can even vaccinate you at your home. Wow. So we should be able to take advantage of this platform so that while we are going through COVID-19 pandemic, that shouldn't stop us from getting ourselves protected from hepatitis that kills 105,000 people in Nigeria every year.
All right, Nsa Abasi, thank you so much for speaking with us.
Thank you so much.